Okay, we're going to talk briefly about child maltreatment because it's unfortunately a part of pediatrics and happens more frequently than most would like. We have one of the worst records among industrialized nations, losing on average between 4 and 7 children every day to abuse and neglect. So as nurses, our jobs often involve recognizing the signs of maltreatment, so knowing the categories is important. The most common form is neglect, and the second is physical abuse, followed by sexual abuse, emotional abuse, and torture. It's important to note that these are not happening in isolation. They can occur at the same time. So our jobs as nurses is to report any suspicion of abuse. You should not confront the family, interrogate patients, anything, because that could put you or the child in danger. So leave the investigating up to the professionals. At Carl, there is a child abuse team, and if there is suspicion of abuse, we can put in a consult for them to come and start the investigation process. So this 70% is due to the lack of musculature in their neck and how much larger their heads are compared to their bodies. So often those deaths are due to abuse of head trauma or shaking. It's important to note that abuse occurs at every socioeconomic level across ethnic and cultural lines within all religions and at all levels of education. There is a supplemental video from Dr. Riefsteck at Carl up on Blackboard. He heads the child abuse team, and that goes into much more granular detail about this if you are interested. I'm just going to pull the lens back a bit and go over what usually shows up on exams and what is clinically relevant, since this could very well be a 3-hour lecture all on its own. So sentinel injuries are minor injuries that are considered potential signs of abuse. So those include bruising, especially on infants who aren't pulling to stand, okay? They don't bruise easily and they heal really fast. So the saying kind of goes, if you don't cruise, you shouldn't bruise. Fractures are concerning as well, especially of the posterior ribs, the sternum, the acromion, or shoulder, and the occiput. Also, most importantly, any injuries that are inconsistent with the history and presentation of the patient should be questioned. If there are differing stories between caregivers, that's pretty common. You know, which parent do you think is most commonly the abuser? It's mom. It's kind of surprising, right? So as nurses, you are legally mandated to make a hotline call if you have reasonable suspicion. The number is 1-800-25-ABUSE. About half of the calls do lead to investigations. In 2019, they took 182,000 calls and made about 64,000 investigations. That's 21 calls an hour, folks. That's a lot of calls. Those who are answering the phones are all bachelor's or master's level trained for this, and each call is taken seriously. So as I said, Carl has its own internal process for this as well. I've seen it used quite often. We will usually see a handful of active DCFS cases on the floor in any given semester. Again, if this is something that interests you, there are so many vacancies across all aspects of child abuse prevention, investigation, and treatment. I encourage you to look into it if it is something that you may be passionate about, because the need is truly great. That's going to conclude this little maltreatment mini. Have a great day.